Approximately half of all people today that are going on Medicare are choosing Medicare Advantage plans for their coverage. And if you're one of those, we want to make sure that you're on the very best plan possible. So in this video, I'm going to show you how to choose a great Advantage plan. Now, the first and probably the most important aspect of a decision to take an Advantage plan is to make sure that you're going to be happy with the providers that are available to you, which means your primary care doctor, any specialists, any hospitals that you would like to go to, durable medical equipment providers. So we look at the network first. Now, there's two types of networks. One is HMO and one is PPO. So let me kind of explain the difference here because we want to make sure that you go on the very best plan for you. All right, so we have HMOs and PPOs that are available. Now, what you're going to notice when it comes to Advantage plans, financially, your HMO plans are going to be more attractive. They're going to have lower copays as well as lower max out of pocket, all right? And sometimes they'll throw in a few additional benefits for dental, vision, hearing that may be a little bit more attractive than a PPO. But you also have to be aware of, though, that with the HMO, there could be some limitations, some restrictions. Number one, probably not going to be as many providers. Now, in metro areas, there's still probably plenty, but it will be less than the PPOs. And the reason for that is because whenever you see an HMO provider, they don't get paid as much by the insurance company as what that PPO provider will be. That's why there's more doctors and hospitals that are willing to be in that network. And again, it doesn't make it bad. There's some wonderful HMO Advantage plans, but you have to be aware there could be some restrictions as far as physicians and other providers. Secondly, there are some times where an HMO plan is going to require that you get a referral from your primary care doctor in order to see a specialist. All right, and so that could be a limitation. Again, that's not necessarily a bad thing. They're just going to make sure that you get that referral, you're going to the right specialist. But if you don't like that, you're probably not going to want an HMO. The PPO plan does not require you to see a primary care doctor, to see a specialist. You call the specialist up, that's within the network, and you make the appointment yourself. You don't have to have a referral, all right? And the other difference between these two networks is this, out of network. So if I decide that I would like to go out of the network, here's the way these work and the differences are. If I'm on the HMO plan, you cannot go out of network unless it's an emergency room situation or an urgent care situation. You actually, on an HMO, can go out of network in those two scenarios, urgent care or emergency room, anywhere in the world, all right? But if it's not that, then you are confined to stay within that network of providers within the HMO. PPOs allow you to go out of the network, and you can actually go to any provider that takes Medicare. The issue is, though, if I stay in my PPO network, my copays will be less, my max out of pocket is going to be less. If I go out, it's just going to cost me more. If I stay in my network, I may see a specialist for, let's say, $25 or $50. If I go out of network to see a specialist, it could cost me maybe 20 or 40% coinsurance. If I stay in my network on a PPO, my max out of pocket is probably going to be $3,000 to $5,000 for the whole year. I go out, could be $7,000 to $10,000 a year. But again, with that PPO, you have that option. And so to pick out a great Advantage plan, you've got to first of all look at the network to make sure you're going to be happy with that network. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. So once I'm comfortable with that network and I know my providers that I want to see are going to be in the network, then I'm going to look at the second aspect of these plans, and that is the out-of-pocket expenses. Now, I will tell you there are some items that will be zero for you, meaning there will be no out-of-pocket expenses. Almost always, the plans, if you want to see your primary care physician that is in the network, there's typically a zero copay. Any kind of preventive visit you have is going to be a zero copay. They'll probably embed a drug plan at a zero premium. So the whole point is there will be a few zeros on your Advantage plan. But the rest of the services that are not zero are going to have a very reasonable copay. So to see a specialist, that would be maybe $25 to $50 copay. And I'm talking about, for a lady, an OBGYN doc, maybe a cardiologist, a dermatologist, an endocrinologist, orthopedic. Again, those kind of docs that are specialists, you're going to pay a copay. I've never seen a plan yet that has zero for that, only the primary care doctor. The next thing after specialists you want to look at, let's say you had some kind of an outpatient procedure. you went in for let's say a gallbladder removal or a hernia operation, or maybe had a knee replacement or cataract surgery. You want to know, what is that outpatient procedure going to cost me? I would say in the range of probably anywhere from about $250 to $400 copay. All right. Now, what that does, that $250 to $400 copay is going to cover everything in that outpatient facility. These are called ambulatory surgical centers. So that copay includes the surgeon, it includes the anesthesiologist, all the nursing services, and the facility fees as they take care of you. So very, very reasonable copay, but you got to be prepared for that, all right? And then if it were me, I'd be paying attention to what's it going to cost me to get a CAT scan or to get MRI or get a PET scan. And again, it will vary plan to plan, but pay attention to out-of-pocket on this. And I would say it's going to be in the neighborhood of about $150 to $250 for that scan. This would be each time you had one of the scans, you would have that. And then also you want to pay attention, if you go to the hospital, what will it cost you to be hospitalized? All right. And again, this is going to vary plan to plan, but as a general rule, this is going to be anywhere from about $300 to maybe $400 a day in the hospital. And that's going to go anywhere from maybe 5 days, some are 7, some are 9, but it's not going to be forever. But they'll set a limit to the days, and then after you've hit that limit, then there's zero cost to you to be in the hospital. So that daily hospital copay that you're responsible for, everything that happens that day is covered by that copay. So you could be in and just have standard care, cost you $300. You could be in and you could have a surgery that day. Anything happened, 2 MRIs that day, still cost you $300. So my point is that daily copay is going to cover all the expenses for that particular day, and the Advantage Plan is going to be responsible for the rest. And then again, there will be a certain limit, and then after you've hit the limit, it's zero. Now do remember though, that is per hospitalization. So if I'm in this month for 3 days, it costs me $900 to $1,200, and then 2 months later I'm in for 5 days. It's going to cost me $1,500 to $2,000. So it's each hospitalization. So you want to pay attention to this. And then lastly, I want you to pay attention to, is there any kind of co-insurance on the plan? Now, most things are going to be copays, okay, these services I talked about. But read the fine print, pay attention to the details, and see if there's any situation there where there's going to be some co-insurance, which means a lot of times chemotherapy. The plan pays 80%, you pay 20%. Sometimes we'll see it in an outpatient surgery. Plan pays 80%, you pay 20%. So pay attention to that, because those are kind of things that can be really shocking to you. But you want to look at the out-of-pocket expenses so you're comfortable with those, because that's your liability. And then also you got to remember, every plan is going to stop somewhere out-of-pocket expenses. They call that the max out-of-pocket. And the max out-of-pocket is established by the plans. Now the HMOs are almost always lower max out-of-pocket. Remember I said they make those a little bit more attractive financially, because you have some smaller networks and some restrictions and rules, right? But the max out-of-pocket is typically going to be lower on HMOs than PPOs. All right, but you want to pay attention to that. And so, and again, we're a nationwide company, so again, I'm broad brushing this. It's going to vary plan to plan, but you're going to see these max out-of-pockets anywhere from about, on an HMO, somewhere between about $2,000 a year to maybe $4,000 a year, okay? On a PPO, going to be a little bit higher because you have the right to go out of network, and those are going to be anywhere from about $3,000 to maybe $5,000. Now, the highest I've seen lately is $6,750, okay? They actually illegally can go higher than that, but I haven't seen any plans this year that are higher than that. But the whole point is this. I have to pay copay until I hit my max, and then I'm going to be done. Put your checkbook away, put your wallet away. We're not going to be out of pocket any longer once you've reached the max. And then these max out of pockets reset every January, and then again I start paying my copays again until I hit my max. All right, so that's the way the out-of-pocket expenses are going to work, so be sure to pay attention to those details. All right, so that was the details of the inpatient and outpatient copays and max out-of-pockets. Now let's talk about the Part D plan. Now, keep in mind, the majority of you that decide to get a Medicare Advantage plan, you're also going to include a Part D plan. We call those MAPDs. And again, that's the majority of the population. But I do want to note here, if you are someone that qualifies for VA, meaning you can get your prescriptions to the VA, or you have TRICARE for life, which means you served in the military, 20, 25, 30 years or whatever. You have TRICARE for life, and you can get your prescriptions through the TRICARE plan, or you're retired from the federal government and you have what's called FEHB, Federal Employee Health Benefits. This would be GEHA or FedBlue or one of those carriers. You can actually get your medications through those, which means then you can get what we call an MA only plan. MA only, which means for the inpatient and outpatient, you're using the Advantage plan, and your TRICARE and FEHB will actually coordinate together with them. And so you just have in and outpatient coverage, but your prescriptions, that Part D plan, you're not going to get because this is credible coverage, and you get your prescriptions in this system, which is really, frankly, better for you. All right. Now, if we're not in these three categories, you're going to get an MAPD. It'd be really, really risky to not get a prescription drug plan. So you'll want one. Even if you don't take meds now, that could easily change. So these three groups of people, you can get MA only plan. I'll show you in a minute why some are choosing to do that. And actually, lots are choosing to do that. So let's go back now. We're talking about now MAPD plans. So that means that plan has actually embedded or included a prescription drug plan as part of my coverage. So as we talk about choosing a great a plan, you want to make sure that your medications are going to be covered. All right? And so it's kind of like making sure your doctors are in the network. In fact, this has happened today. I was talking to a lady that had called into our office, and she was at her doctor's office today. And she said that she was just waiting in the lobby, and a lady came in, and she was on a new plan and just found out that day that her doctor was not in the network. And so that agent did not let her know that. And that's why I was saying you got to make sure that your doctors and hospitals that you want to go to on the Advantage plan are going to be in the network. And she got a real shocker, and she was very frustrated, this lady told me. Same thing's going to be true when it comes to drugs. You got to make sure that your prescriptions are going to be covered well, because they're going to embed that prescription drug plan, and you're going to make sure that your medications are going to be covered by the plan. So that brings us to the aspect that we're checking. First off is the formulary. Now, when you work with anyone like us, any reputable broker, what we're going to do is we want a list of your medications. What are you actually taking? If it's a brand name, I want it. If it's generic, that's what I want. Dosage frequency. And we're going to put that into our system to make sure your medications are covered. So we're going to look at the formulary. All the formularies are going to be given tiering numbers. These are the prescriptions covered. So it's going to be a tier 1 or tier 5. And so you want to know what your medications are tiered at, because the lower the tier, the lower the copay. You could be on a tier 1 medication that has a 0 copay, maybe a tier 2, a $5 copay, tier 3, maybe a $45 copay. But the whole point is you want to know the tiering of your medication, so you're going to be very clear as to what your copays will be. You also want to find out, does my plan have a deductible? Now, the highest deductible we can have in 2023 is $505. Some plans have 0 deductible. Some have maybe a reduced deductible, but never more than $505. And that just simply means your copays will be applied to the deductible. All right, so pay attention to the structure of that particular drug plan. All right, now the good news is what happens is every year when we go through this season we're in right now, these MAPD plans, and this is October 15th through December 7th, you actually can change your plans, right? And we're in that period of time right now. So let's say that this year my Advantage plan is covering my medication, and next year they're going to drop that. Maybe you're on insulin and your plan is not going to be participating in that reduced insulin savings program. Well, you probably want to get off of that, because you want to make sure that your medications are, number 1, covered, and number 2, you're going to get the very best cost possible. And then also pay attention to this, and that is the network of pharmacies. And the reason for that is because there could be a pharmacy that is what we call preferred pricing versus standard pricing, and sometimes that matters. So you want to make sure the pharmacy you're going to is going to be a preferred provider if that's possible, because you'll see substantial savings as a result of that. And then finally, that brings us to the last aspect of Advantage Plan, and that will be the perks, these additional benefits, value-add benefits that come with the majority of Advantage plans, all right? And so almost every plan today is going to include some type of a dental benefit. And that's going to range plan to plan, but it's going to be at minimum of $1,000 for the plan. Sometimes they're $1,500, maybe $2,000 or even more for people that are also qualifying for Medicaid. But the point is they're going to have a dental benefit, and that $1,000 is a benefit for a year. Typically, you can go anywhere that you want. If your plan, if your dentist doesn't take the plan, then you pay then it's direct, and then you can send a receipt in and you'll get reimbursed for that limit. And again, some of those are a little bit higher, but there's usually some type of a dental benefit that's with the plan. There's also going to be some kind of a vision type benefit, and typically what that means is you're going to get one routine eye exam, which is very, very nice, okay? No cost to you on that. And then you are almost always going to get some kind of an allowance for eyewear. So this would be glasses or contacts, right? And so that's going to range anywhere from $150 to maybe $250 on an annual basis, all right? So again, that's one of the perks that come with most Advantage plans. And then also hearing aids, okay? DVH. So these hearing aids are going to be typically some kind of a network. This could be certain hearing aids that they're going to cover. You have to buy them from certain vendors. And normally with this, there's a very reasonable allowance as well. You may have a copay of $300 or $500 depending upon the brand that you pick out, but then that Advantage plan will cover the rest of the cost, right? So that's really a nice benefit for hearing aids, so look at the details of that. And then almost all of them are going to have also a gym membership. Now there's actually two types of networks that are available right now. There's one that is called Silver Sneakers, and that's probably the largest one. And then one insurance company has their own, and that's called Renew Active. And the whole point of me listing this is because you want to make sure that if you go to a certain facility, maybe a YMCA, a community center, maybe Curves or some other Lifetime Fitness type place, that your facility is in the network, and they will allow you to have a free membership because you're on that particular Advantage plan. So that's a nice perk, especially people that are having to spend $40 or $50 a month out of pocket for their own gym membership. Now that could be included at no cost to you as long as that facility is within the network. Okay, so those are the kind of the nice perks that come with Advantage plans. There's another one right now going on, and this is called an Over-the-Counter Card. Over-the-counter card simply means that they give you a credit that's put on a card, and it's usually about $50 a quarter, sometimes a little less, a little more. But they allow you to go online or through their catalog and actually pick out things that you would typically get at a drugstore, a CVS or a Walgreens or wherever. And they reload that card every quarter with that $50 or $100 or whatever it is. And so I do know this, that if you don't use it, you lose it normally. So you want to make sure you're taking advantage of that if your plan is going to include that. Okay, so those are very, very common. Then lastly, I want to talk about this perk that certainly is not going to be in every plan, but it's talked about a lot. And there's a lot of interest in this, and understandably so. And that is called a Part B reduction. All right, so what this simply means is that the Advantage company gets money from the federal government every month, usually about $1,000 or so. And they have the right to take a portion of that money they get from the federal government and credit that towards your Part B. Now, this year, I'm shooting this video today, October 26th of 2022. Part B is $170.10 a month for most people. Now, that's providing you're single and your income is below $91,000, married couple below $182,000, you're paying Part B premium of $170.10 a month. Now, that number actually is going to go down next year. Part B for 2023 is going to be $164.90. Now, let me explain. Again, there's income thresholds to determine this. So a single filer next year, as long as they're below $97,000, modified adjusted gross income, or a couple below $194,000, each of you then would pay $164.90 a month for your Part B premium. If you're on Social Security, it comes out of your check. If not, they bill you for that on a quarterly basis. So when we're on an Advantage plan that has a Part B reduction, what they're doing is they're taking a certain amount of money, and again, this varies, but it's anywhere from $30, I would say averages $50, and sometimes $100 a month, and they're going to give you a reduction for your Part B. They do not send you a check, okay? If you're on Social Security, and let's just say we have a $50 Part B reduction, instead of them taking $164.90 out of your check, now what are they going to do? They're going to take, I'm using this $50 example, they're going to take $114.90 out of your Social Security check. So that's how we got our $50 back. They reduced our Part B. Now, if I'm not on Social Security, I'm on a direct bill basis, then what happens? They'll reduce my Part B premium by that $50, so I'll see my direct bill go down in amount. So either way, you're going to get it back. It's just not a check sent to you. It's added to your Social Security check, or it comes off of your direct bill with Medicare. Okay, and so I just want to make sure you know these are available. So a great Advantage plan may have that. I would tell you this, just as a word of caution. I like Part B reductions. I love it when a plan has that. But here's what I want to make sure you understand. If you have a plan that has a Part B reduction, don't just focus on that. Okay, first of all, we're looking at networks. Make sure we got a good provider network. We're paying attention to copays, max out of pocket, all my prescriptions. So if they add that to it, you want to make sure all those other things are also very attractive to you, because I have seen this. Again, there are exceptions, but I have seen this before when someone had a Part B reduction of $50, but within the plan, that plan actually changed something, a benefit, and it was not as attractive, which means this. I looked at a plan that had no Part B reduction, and the outpatient surgery copay was $250 a month. A plan with the Part B reduction, someone gets back $600 a year, now the copay was 40% coinsurance. So if they had a knee replacement or some outpatient surgery, they had to pay substantially more, okay? So the point is, make sure if they give that to you, it's not hurting you with some of the benefit, because frankly, I'd rather have a low copay out of pocket for my outpatient surgery than just get that $50 Part B reduction, okay? I'm telling you, they're going to rob from Peter to pay Paul sometimes, so be cautious about that Part B reduction. It is legitimate. It's certainly not in every plan. We just want to make sure that that plan is still attractive when they're giving you back that particular amount of money.
Hey, if you're looking for someone to help you hold your hand through this entire Medicare enrollment process, we would love to do that. Our team is standing by to help you. We help about 1,000 people a month go from Medicare confusion to having their plans enrolled, and it takes probably less than an hour. Go to the pinned comment below and you can book your appointment.
All right, so those are our perks that you're going to see for 2023 plans, and you want to make sure you look at the details of those so that you can pick out a great Advantage plan.